Good afternoon, everyone. It's a pleasure to host this meeting this afternoon. I hope that everybody's having a fine day and that this panel will make it even finer. First of all, I'd like to welcome all the panelists. Thank you for finding time to join us at this discussion this afternoon. Very short introduction. With us is Dr. Korolenko, who is the Deputy Head of State Services of Medicines and Drugs Control in Ukraine. Volodymyr, it's very good to have you with us. Can you hear us? Yes, you can. Okay. Also with us is Dr. Martin Smatana. Martin, it's nice that you found time. I know that you are extremely busy being active at some ministries at the same time and chairing a board right now, a supervisory board of the, I think, biggest insuring fund in Slovakia. So you're really extremely busy person. So I do appreciate that you found the time to be with us. Well, my warm greetings and welcome to Mrs. Iwona Pylak, who is Deputy Director of the Department of Excise and Gaming Tax at the Ministry of Finances in Poland. Ms. Director, it's absolutely gorgeous to have you with us this afternoon. Thank you for joining. Well, at this point, the last but not the least, Emanuela, it's so good to see you after a couple of months. So,
thank you.
A very stable point of our discussions. Associate Professor of Economics at the University of Verona, Emanuele Bracco. Emanuele, it's good to see you and good to have you. Well, right 15 minutes ago, I've got a message from another panelist who will not join us today. It's Arkady Sharkov that usually was with us at this subject too, but he a couple of months became the advisor to the Minister of Health in Bulgaria. And they have now a crisis about the vaccines and talks with the Pfizer. So they met this afternoon and that's what made him, well, he preferred being with his minister than being with us, which I appreciate. Well, thanks again. Well, for a short introduction, let me just show a couple of slides. Are they visible? So as you know, today we will try to discuss our way to the world-free of smoke, to look at the tools. Do we have them? Do we recognize them? Do we use them properly? And finally, I'd like to put a thesis that there's a tool that it's not being widely used, and the tool is the excise tax. I'll put the thesis that the good way to go is less harm, less tax, not only in cigarettes, but in every behavioral taxable, like alcohol or any other. So we'll look at that. Well, we will look at the longevity. So the expected lifetime at birth, we see that it's proportional to the wealthness. So it's proportional. The longer, the more you earn per capita in the country, the longer you live. But you see that it's not a 45-degree angle, but the curve is going quite flat. If we looked at the same curve 200 years ago, it was a little bit steeper. And when we compare these two, we see that the difference to the green, so to the 1-to-1 ratio, is really significant, which means that something except for money influences the longevity, so the expected lifetime of every of us, no matter what country we live in. And I'd say that at the level of the beginning of 19th century, these were wars and plagues, both of them very common at that time. And right now, being in the 21st century, we will say about wars, plagues around the world, especially being a couple of days after the official pandemics of COVID-19. But we do have another enemy. We have the non-communicable chronic diseases, and that's why the targets were for 2025, but they have been postponed until 2040. And all the targets we are expected to reach for the benefit of public health are those that are linked to the non-communicable chronic diseases. So these are mostly behavioral targets, and amongst them, amongst them we do have cigarette smoking, of course. We have excessive drinking. We have unhealthy diet. But for the benefit of the today's meeting, we'll focus on this in a reduction by 30% of the habit of cigarette smoking. Of course, myself, being amongst other public health specialists, I focus always on the role of public health in achieving these goals. Especially, I'll focus on the prevention system. We have several stages in prevention. Well, the most common division is into 3 stages. And this is the 3 stages I present you because the primordial and primary are very commonly set into one group. So we have something that is at the bottom, which is a bottom line education. Let's imagine that we want to really have a smoke-free society. So educating the kids at the beginning, at the kindergarten, at school, will be the good way to start. This is what New Zealand did and Sweden did 15 or 20 years ago, and now they can claim that they break with the with cigarettes and they want to be cigarette-free or smoke-free countries. But it took them 10, 15, or even 20 years of education prior to other things. And one of the other things, the other tools, because the tools are what we expected to talk about today. So the other tools that we're using is the social support. Well, support at this point means no acceptance. So no acceptance for those who smoke, just moving them out of the society, moving them out of public space. Well, maybe it's a very rude, but it's very brutal, but it helps. It's support for them in meaning that, please join us, but first of all, give up smoking. And this is the lack of acceptance sense of existence in term of smoking quitting. Of course, banning everything, banning smoking, but banning also commercials is an important part of, it's an important tool that we using to support the smokers to quit. Then we'll, of course, we need to remember that the basic tool is, or at least should be, medical intervention. So every doctor during every single visit should address the patient, especially smoking patient, and try to convince him to start thinking of quitting and then to quit smoking. This is the basics. It's not in every country stressed so much, and I'd like to hear from you what's the case of your countries, but I think this is the basics for what we can do. Whatever we do, with banning, with lack of social acceptance, with all the medical effort, we will have always a group of people who will not give up drinking, smoking, or other bad habits. And 40 or 50 years ago, a term has been introduced in palliative medicine, or afterwards in medicine in general, which is being called harm reduction. If we cannot make people stop bad habits, we try to switch them to the behavior that will reduce the harm of their habit to their health. So the harm reduction is also a tool that has appeared, has been accepted in some countries. In some countries has been accepted only for, hard drugs or heavy drugs and not for other things. And there are some countries that the harm reduction attitude is absolutely not accepted. And this is also the subject I'd like to talk today about. Of course, as I already mentioned, the basics is the medical intervention. It's being divided into parts, but for the benefit of today's meeting, let's say this is one tool, medical intervention only. I'd like to draw your attention, both you panelists and all those who are listening to us or will be listening to the recorded panel, to this graph showing the history of, well, let's hope, of the success of New Zealand in claiming a cigarette-free country. As you see, they've started at the early 2000s, and they introduced two parallel ways of action. One was only educational action that was directed to children and the youth, and the second was the regular action that all our countries were taking, including the fiscal tools, the social tools, the bans that I just spoke about at the previous slide. So they had like two parallel policies, of course, one supporting the other, and this brought, after, well, almost, as I said, over 15 years, it brought them to the point that they can say, okay, now we take a risk, having not even 9% of daily smokers and no daily smokers in minors to 15 years old. Now we take a risk and we say that we stop selling cigarettes to those who are coming of age at this point. But once again, it took them 15 years to prepare to this. During the same time, for the 10 years, in Poland, we also had some format in this matter. When we see the exposure about the SHS, as you all know, this second-hand exposure. So this is only the exposure of those who do not smoke, which is not the success of cutting smoking in the society. No, these numbers show only the success of preventing or preventing non-smokers to be exposed to the cigarette smoke. So this is a success, because if we say that 8.2 million people worldwide die yearly because of cigarette smoking, million of them are passive smokers, so second-hand smokers. So this is protection, but only for those. But still, when we look at that, we still have almost 30% of daily smokers in Poland, and this is very new data. It has been recently published 4 weeks ago, the report of the Polish Academy of Sciences, actually the Public Health Committee of this academy. But anyway, this publication has moved many people and has moved many rumors and really ruffled the bushes around in Poland in this subject, especially that, well, sorry, it's very little, but especially that when you see at the financing of prevention, including prevention of all the risk factors for NCDs, which I started with this presentation, Poland is very low in these expenses. So we really cut down the expenses. We are the country amongst the OECD countries that cut by 9% the prevention expenses in the past 10 years. Past, well, we counting the years until the COVID-19 pandemic started. So from this point of view, summarizing what I have said, we have several tools divided into three groups: social tools, so social acceptance, social banning; financial, that is most of all excise tax; and medical, which is medical intervention, and then introducing harm reduction. So focusing at these three groups, I'd like to start the discussion in a while, but before we go to that, as a second introduction, I'd like to ask Director Pylak to tell us how are we doing, how good are we doing with the excise tax in Poland. So thank you for this part, and Director Pylak, the floor is yours. Well, the screen is yours.
Ladies and gentlemen, I have been introduced, so I will not be introducing myself again, but hopefully the presentation that I prepared will be to your expectations, because I think it's very much connected with the topic of the webinar. Let me now try and switch slides, but unfortunately something is happening. Tak, trzeba na tych slajdach to So let me start by telling you that the market of tobacco products is, of course, subject to many regulations, directives, for example, the excise directive and our other national laws. When we're talking about the law, the biggest and most important law is the Council Directive from June 2011 to make sure that we have high level of health protection. But of course, when we're talking about tax regulations, the International Framework Convention of Tobacco Control by WHO plays also an important role. Another important tool to curb the consumption of all kinds of substances, including alcohol and tobacco, is, of course, the right fiscal and tax policy. And the professor said that. So curbing smoking through pricing of cigarettes is really an important part. And it is very much in line with the FCTC convention. And Poland, as it ratified the convention, acknowledges that pricing and fiscal tools are effective to curb tobacco consumption by many social groups, including young people. And of course, the WHO confirms it, saying that increasing the price of alcoholic beverages through taxation is one of the 3 tools, apart from, of course, limiting the number of points of sale and limiting advertising. It's one of the most effective and easiest tools to curb consumption of alcoholic beverages. We at the Ministry of Health and the Ministry of Finance do monitor the market, and from our monitoring we see that higher prices motivate people to a great degree to quit smoking. 10% hike in a price on tobacco products contributed to average reduction of the number of smokers by 4%. The Polish tax system assumes that tobacco products are cigarettes, cigars and cigarillos, smoking tobacco, but also other herbal products for smoking, like CBD. So if those products are similar to smoking tobacco, they will be subject to similar taxation. But products that don't contain tobacco and they are used for medical purposes are not treated as tobacco products. But right now, the Ministry of Finance is not the competent ministry to decide which product is medicinal and which is not. This is done by the Ministry of Health, and of course we collaborate with the Ministry of Health all the time and design and draft new laws and regulations. Poland has seen dynamic changes when it comes to tobacco products and the market and consumers' preferences. So, for example, there are nicotine pouches. According to the definition of the European Union and our national law, are not treated as tobacco products. So they are not subject to excise tax. But right now we are working on making sure that nicotine pouches are subject to this taxation, because right now this product is sold in Poland, and actually it's similar to tobacco products, especially that those pouches have nicotine, plant fibers, and aromas. But snus itself in Poland for oral tobacco use is prohibited. So we see some problems with the market of tobacco and nicotine containing products. So we want to create a wide definition so that all products are included, like for example, toothpicks that contain nicotine, because they are becoming more and more interesting to many consumers. So the efforts that we do, of course, need to be coordinated with the Ministry of Health, like for example, establishing a cap, a limit of nicotine concentration to make sure that a given product is subject to taxation. Showing this slide, I just wanted to show you levels of different products. Traditional cigarettes have the highest tax. So the share of excise tax and VAT is over 81% of the price of cigarettes. When it comes to innovative products that are supposed to substitute cigarettes, because nicotine is being absorbed differently, excise duty and other taxes cigarettes. And given the fact that the pack of cigarettes is 20 grams of tobacco, while those innovative products in one pack, in one unit, have around 5 grams, those innovative products, let's say, are privileged from the point of view of taxation. Innovative products as well. They have a better tax situation, let's say, compared to traditional cigarettes. After there was, we're planning a hike in excise tax. And once we've introduced this hike, we will be somewhere around EU average when it comes to taxation of both cigarettes and innovative products. I'm trying to just give you a knowledge pill, show you our tax system. So I'm slowly finishing the presentation. I have 2 last slides to show you how we're planning to introduce new taxes and how we're planning to increase taxes. Our roadmap for 2023-27 assumes each year there'll be an increase of 10% for cigars, smoking tobacco, cigars and cigarillos, heated tobacco products, and so on and so on. And what I'll show you on the following slide, excise duty on wine, beer, alcohol, and strong spirits will also increase by 5% each year. Let me tell you that in order to create this roadmap, we wanted to limit the price availability of tobacco products and other substances. And also, we would like to alleviate the effect of inflation, which is high, and could also lead, if we didn't do those increases, could lead to us failing to curb smoking of tobacco products. Let me also tell you about one more tool that we can use, and we've been using it since 2002. We have increased the minimum tax rate to 105%. So the cheapest cigarettes in 2021, they had a share of over 65%. Those cheap cigarettes are actually the greatest gate for younger people to start smoking, buying those cheap cigarettes, especially that cigarettes have become more and more popular, which is very, very alarming. So our medical community decided to counteract. Also, our fiscal authorities and tax authorities, including the Ministry of Finance, decided to react as well. And we increased the minimum excise duty on cigarettes to 105%. So in 2002, the share of cheap cigarettes in the market of cigarettes fell by 15% or more compared to the previous year. So actually, this new regulatory system, after the first year, we can see that it's proven successful, because the share of those cheapest cigarettes, the most dangerous ones, actually has fallen in the market. So this slide, the one you see right now, shows you increase of excise tax rates on alcoholic beverages. I just wanted to say this briefly, because we have a lot of evidence from research saying that alcoholic beverages, if they're cheaper, they are consumed more. And then, of course, all kinds of social and health problems arise.
Yeah.
So the right fiscal policy, the right tax policy is one of the basic tools that help us to reduce harm caused by alcohol. But actually, alcohol tends to be linked to the consumption of tobacco products.
Absolutely, and thank you for this. And we will stop at that point because we are a little bit overdue. And let me support very strongly what Director Pylak just said.
Thank you so much.
Well, the less harmful the product is, the less tax is being put on it. So it's not that this is a healthy product. No, this is a less harmful product. So the action less harm, less tax seems to be a part of the fiscal policy of public health in Poland. Is that what we understood from your presentation? Is that right? Director Pylak, is that right? You agree with this thesis? Yes, thank you. Okay, so
definitely
we'll support the thesis for the wrap up of the panel. We are a little bit of time, but I'd like to ask Dr. Korolenko, Volodymyr, would you please give us a presentation of yours? But I will very much appreciate if you are in 6-minute time for the presentation. Thank you in advance.
Thank you. Dear colleagues, let me first of all give many thanks to Professor Fal and your team for inviting me and organizing this wonderful event. Today I will focus on some novelties of the anti-tobacco legislation for Ukraine. The war provoked an increase in the level of stress among Ukrainians, and this leads to risky behavior, including increased tobacco consumption. And in this context, it is appropriate to remind about the risk of passive smoking and inhalation of secondary aerosols. According to WHO data, the global tobacco epidemic kills more than 1 million people in the world every year, and about 13,000 Ukrainians who are not smokers die from diseases caused by secondhand smoke. The Kyiv International Institute of Sociology conducted a study that showed an increase in the level of tobacco smoking in all studied cohorts. World Health Organization emphasizes that there is no safe level of exposure to secondary aerosol from both electronic cigarettes and tobacco products for heating. Like cigarettes, electronic smoking devices generate side stream or secondary aerosols. That is what the smoke inhales into the environment. Secondary aerosol contains acetaldehydes and formaldehydes, volatile organic substances, nicotine and heavy metals, which have a toxic effect on human health. In addition, there is more nickel and chromium in such an aerosol than in smoke from ordinary cigarettes. So in December 2012, amendments to Ukrainian law regarding the expansion of the list of places where the use of tobacco products is prohibited entered into force. Changes to legislation have led to a significant reduction in tobacco use in subsequent years, as well as a reduction in the number of people exposed to second-hand smoke. The modern challenge is the smoking of electronic cigarettes and hookahs, despite the legal ban on their use, as well as the aggressive promotion by the tobacco industry of the return to tobacco use to public spaces thanks to electronic smoking devices. On December 16, 2021, the Ukrainian parliament adopted a new law on amendments to certain laws of Ukraine regarding the protection of public health from the harmful effects of tobacco. The norms of this law are aimed at introducing attractiveness of tobacco products, protecting against the effects of second-hand tobacco smoke, emissions from electronic cigarettes, and the aerosol of tobacco products for heating in public spaces, etc. Among the main innovations of this law, the following can be distinguished as on the screen. Since 11th of July 2022, the law Ukraine introduces additional rules for the protection of smoke-free environment. In particular, smoking, consumption, and use are prohibited devices for consuming tobacco products without burning them, herbal products for smoking, items related to their use, tobacco products, hookahs, electronic cigarettes. Smoking of electronic devices for heating tobacco becomes prohibited on a par with cigarettes, hookahs, and e-cigarettes in public places defined by this law, as you see on the screen. The results of a study conducted by the Kyiv International Institute of Sociology showed the overwhelming support of Ukrainians for new anti-tobacco legislation. More than half of the respondents showed a proactive attitude towards compliance with this law. The majority of respondents also expressed their support for the strengthening of anti-tobacco legislation in terms of increasing taxes on tobacco products and a complete ban on the visible placement of these products in stores. You can see the Public Health Center of Ukraine has launched a special web service and applications for smartphones for prompt response of citizens to violations of anti-tobacco legislation. In 2022, Ukrainian Parliament approved a new law on the public health system law. Its main goal is to regulate the mechanisms of creating an effective public health system in Ukraine, which will help strengthen the population health, prevent diseases, and increase life expectancy. In this law, for the first time, the concept of a harm reduction strategy for combating tobacco smoking is normalized.
Thank you very much. Thank you very much, Dr. Korolenko, for this interesting introduction of yours. And well, one quick question: what is the availability of the new technology products, well, heat-not-burn products or e-cigarette products in Ukraine as compared to the regular cigarettes?
Yeah, they are available and widely used. So new law was very necessary to protect people, passive smokers from using of electronic devices.
Okay. Thank you. And the first question goes to Dr. Bracco. Manuela, tell us, because, well, the message from Poland is that the taxation should go less harmless tax. How are things going in Italy about the taxation of cigarettes and the innovative products from this group?
So, well, thank you so much for inviting me here, first of all. So, well, taxation in Italy on these products is in some way similarly to Poland. These innovative products are taxed less than factory-made cigarettes. There was quite a bit of political debate on how much to tax them, especially because as soon as these new products came and some consumer switched to these new products, the government was mostly worried about losing revenues. And here we see already how much there is a bit of a conflict in the government, who may be being used to have revenues from cigarettes and tobacco products, is not too keen sometimes in taxing less products which are alternate, which may become a viable alternative to consumers, in fear of losing revenues for excise taxation. On the other hand, we need to remember that taxation on cigarettes is there, we think at least, we hope, that is there mostly to discourage consumption of harmful goods, which impose an incredibly high cost on healthcare systems and of course also a human cost to families. So the idea that the taxation is differentiated according to harm level, it seems it's almost obvious from the point of view of an economist. Of course, governments have a revenue concern, and we also know that we would like to live in a world in which the government discourages the use of harmful products, but is also not paternalistically dictating to people what to do with their lives. So we want to have, yeah.
Thank you, Dr. Bracco, for this. For this time, I will continue on further.
Sure.
Dr. Smetana, I have a question to you. Martin, you're in the insurance market, very active right now in the insurance market. And you've been to the health ministry, you've been to the education ministry, you've been to the labor ministry. And well, don't you think that taxation, the excise tax, and making of the next year's budget, it's a moral hazard to a politician? Well, on one way, okay, well, we don't want the excise tax. We just stop smoking. We resign. We don't want that this tax. But on the other hand, well, keep smoking, because otherwise the budget will fall down. Isn't it a little bit like that in a real life?
Yes, basically it is, yes. In theory, the excise tax on tobacco should compensate for negative externalities of smoking. So all euros that are created as a result of excise tax should be then inserted into the budget of health sector, but it doesn't work in that way. So from this perspective, we often feel that the main goal of ministries of finance is to make sure that they have a stable revenue flow. For that reason, every couple of years, when the Ministry of Finance prepares new fiscal policies and they look into how they should tax different goods and services, there is always a pressure to reduce the difference in excise taxes of standard combustion products compared to novelty products, because similar to Poland and Italy, we have a difference, because the way how the Ministry of Finance perceives it is that they do not care about medium to long-term impact on health, because if you stop smoking or start smoking something which damages your health less, the consequences on your health will be obvious in, well, 5, 10, maybe 15 years. All they see is 3-year budget or 5-year budget, and they see a difference and an opportunity to increase tax revenues. So yes, the way I perceive it, unfortunately, often the excise tax is misused to maximize revenues, not to maximize long-term value gains for population, unfortunately.
Brutally speaking, every citizen should bring a net income on his expenses when compared to the money spent on taxes. So there should be a surplus, leaving the government the possibility of having the budget the next year. Well, that sounds good. May I have another question also to you, because we saying that the using the excise tax or taxes in general is a good way for the government to show which is less risky or which is less harmful product and which is the more harmful product. And looking from the perspective of an insurer, well, those who smoke are well, possibly or probably will require in the future more costs at the healthcare system. So they'll be more costly for the system because they'll be sick, they'll have COPD, they'll have heart insufficiency, they'll have other diseases that are being caused by the regular cigarette smoking. So wouldn't it be wise to have bigger premiums of those who smoke?
Yes, this is a very good question because we've been discussing it over several workshops and conferences, but in reality, I cannot imagine this to happen because it's very difficult actually to prove that somebody is smoking or stopped smoking recently, and for that reason, it's very difficult to implement in the way it is that it does not discriminate some certain groups. From my perspective, and from the perspective of health insurance company, the best that we can do, considering that you can change an insurance company once a year in Slovakia, and a health insurance company can't refuse you, so it's an open market. The only thing we can do is that that the Ministry of Health will create and force a bonification mechanism for providers of health services, similarly such as quality outcomes framework in the UK, that pays extra for GPs if they provide smoking cessation, if they care for smokers, if they try to persuade them to switch into, in the UK, for example, electronic cigarettes as a part of smoking cessation advice. So this is the only thing I believe that health insurance companies can do, because they can pay extra those doctors or nurses that do these kind of services. But other than that, I don't think that what you suggested, even though it's a good idea, I don't think it's applicable, especially in our region, which is, well, social based.
Absolutely. I do agree with you that in this region, especially this region, and well, all this public money finance healthcare, this will not work. Absolutely. But after summarizing what you just said and what Emanuela said before, can we set the second conclusion for the discussion at the end of the panel that even though buying cigarettes, buying alcohol, we put some excise and we build the budgets of the government, the losses, the public finances have more losses because of the healthcare system, before of the labor loss, the presentees, absenteeism connected to the NCDs. So the losses are much bigger, but they occur a little bit later. That's why we do not see them all. Would you agree, guys, with this as a one possible themes that we will set for the next meeting?
Absolutely.
Okay. Good. Thank you. So now I'll go back to Director Pylak. Ma'am, would you tell me, please, because you were saying about the plans for of the Ministry of Finances for the future. So how do you look at the gray area when you play with the excise tax? Usually, you hear that, well, when we make the cigarettes too expensive, we'll have illegal import, we'll have gray area, we'll have illegal production. We have plenty of things happening. Do you think of that?
Of course, we do. Our fiscal policy has always, especially given our geographical location, has always taken that into account. We are on the external flank or on the external border of the European Union, so we always have to look at threats related to illegal imports. And we might be at risk of an influx of illicit goods into our country. A report on this shows that illicit cigarettes have a very low share. In 2018, those illicit cigarettes were 16.8% share in our consumption.
Illicit
and in 2021, it was 4.9%. So a big drop. Of course, you can say that the fiscal authorities have triumphed, given that. So if gray area is so small, this is the right time to introduce higher excise tax. Our plans that you're asking are, first of all, the introduction of the roadmap, because the roadmap and its introduction is a priority to us. And as I said before, in Poland, we see growing popularity of substitutes to regular cigarettes and products that don't even contain tobacco at all. So they contain nicotine, but no tobacco at all. So there's a lot of interest in nicotine pouches, CBD, dried products. So we can assume that we will need to do something about these products. We will need to take decisive action against these products because their consumption is increasing in Poland significantly.
Okay, so
our closest, nearest plans
Okay.
is to tighten the excise tax system also for substitute products. That's the biggest plan that we have right now in our minds.
Good. So this is very important thing that you just said, that you preparing and you're planning to introduce a roadmap for rise of taxation or changes in taxation. Well, I think this is very important also for the industry to know which way you're going in the future. And this is very important also for the Ministry of Health to see what the consumption, so what the potential health risk will be in the future. So let me stress and go to the other panelists saying that the thesis that comes from Director Pylak's answer is that a roadmap for taxation of the harmful products is something that is absolutely necessary for a good introduction of a health-friendly excise taxation, because otherwise changing it from year to year without a roadmap, without letting people know what's going to happen, it's not the good practice. So this is a very important. I'd like to also to stress it that low harm, low tax, but even if low tax is a planned tax, not all of a sudden. Well, Dr. Korolenko, I'll follow to you with something that Director Pylak just said, that some products become extremely popular in the market and unexpectedly, because I think this was unexpected. Now we all know that the e-cigarettes are extremely popular in the youth. I have a report from Ukraine. Actually, this is a report of Foundation for a Smoke-Free World that's been dated 2021, saying that over 25% of youth between 13 and 16 in Ukraine is using e-cigarettes. What do you comment on that?
We have some sociological statistics, but I think full-scale Russian aggression has created new challenges for the mental health of Ukrainians. So this also explains some of the increase in the prevalence of tobacco smoking and e-cigarettes and traditional ordinary cigarettes and others.
Okay. Martin, so once again, extension to you. Well, what do you think? Well, there are many threats with introducing of new products. You sometimes don't even know which group will be the one that will focus on the product that you just introduced. So I'll give you a subject to focus on, that all the products like heat-not-burn or e-cigarettes should be available only for those who are smokers at present, and only to help them quit smoking regular cigarettes. Is that right?
Maybe right. And in Ukraine, there is certainly no experience of using tobacco harm reduction. We use harm reduction strategy only to prevent the spread of HIV and viral hepatitis. Drug addicts receive methadone and buprenorphine replacement maintenance therapy. So that is why I'm grateful for the opportunity to hear about the experience of other countries and scientific developments in this direction.
Thank you very much, Volodymyr, for this one. Once again, back to Martin with the question, is a strict following that the products should be available only for smokers, just not to, well, maybe for adults, but only for smokers, but not for the youngsters to, well, start another problem that in many countries became a real problem, in some countries even much bigger than smoking regular cigarettes.
Okay, so you know that we published several publications on the topic of how we can reduce determinants of health, or improve determinants of health to improve healthcare overall. And we published the last publication in 2021, and we realized that when we've published it, we also discussed ideas of harm reduction and the way how we can implement it, and what are the limitations of the term, etc. And one of the feedbacks was that we do not have data on what is actually the simultaneous consumption of people who have been smoking standard combusted products and novelty products. And for that reason, we actually just 3 weeks ago finished a massive large-scale official survey, which was done on behalf of university, etc. So we have exact data to see who started smoking at what age with which product, what's the consumption of each product. So we can actually argue with experts in Slovakia on the factual basis. Basically, that's the point. We have not published the data yet because it's very recent, and we want to publish an updated version of publication and then make the data sets available. But it's nice data set. We actually copy pasted CDC methodology, which is done in the USA. But the basic conclusion is that the people who switched from the combusted products to the novelty products, one hypothesis was that they start smoking more because they start smoking in areas which they could not light a cigarette, for example, in their living room or in the cars. So this did not prove to be of significant, well, let's say, volume. And when it comes to how many people actually started with novelty products, so yes, it is true that the nicotine pouches were a problem with very young children. We had a separate survey.
Oh, we have a technical problem.
Yes.
Emmanuel, do you hear me?
Yeah, absolutely, absolutely.
Oh,
No problem.
Hear you all?
All good for me.
Okay, so shall I continue?
I see everything fine. I'm not sure if it's Andrzej's who's
okay. So we were.
I think it's Andrzej's.
Yeah, that's my guess.
But the conclusion was that the children, they are a problem with nicotine pouches, that we saw a significant uptake.
Yes. Okay. Well, thank you for this update, Martin. I'm looking forward to this data because you mentioned them already when we met last time in Wrocław. So I'm very much looking forward to seeing them. Well, Emanuela, once again, back to you. How are the restrictions in Italy? Because once again, I'll stress the thing that we saying about the harm reduction. If we're talking about the harm reduction products, first of all, there must be some harm that's being done and they need to reduce the harm. So in my opinion, it's fine that we restrict this group of products to those who are already harming their health, but at this point, make it so much available to them that they, well, 90% switch to harm-reduced products. How is it working in Italy?
Well, I mean, it's a bit difficult to restrict the use of new products only to people who use the old product. So it is quite unlikely that any government is able to do this. At the same time, I mean, the most likely thing that should happen is to allow the public to be fully aware of the differential level of harm and this differential level, and then they can decide themselves and then use the taxation to orient their choices according to the level of harm, and at the same time possibly allows everyone, including companies who produce and sell these products, to share their views on this differential level of harm. I think that's probably the bottom line.
Thank you very much for saying that. This brings us to the final conclusion that I wanted to reach, actually, that every consumer has the right for full information. So has to be fully informed about the harm of every product available. And to have such information, we need to have research. So we have to prove where is the products are really less harmful or they're not. And to have data, we need to finance research. And this is the conclusion. If we want to criticize, or we want to promote, or we want to do whatever with the new product, we need first to have a research showing that it's really less harmful than the products that we already have. And this should be the basis for its different taxation, for its different position at the market. Would you agree? Who would like to comment on that voluntarily, on that statement? Please, no volunteers. Dr. Korolenko, Volodymyr, please comment on that.
I'm not ready to give a comprehensive answer, but maybe I hear other points of view now.
Okay, do you basically agree? Would you agree as that one of the results of the discussion would be that we need to prove that new introduced products are less harmful or prove otherwise? And then we have the full basis for spatial, let's say, treatment of them. Otherwise, well, all the arguments can be pro or con. Martin.
Sure, I agree, Professor, with you.
Thank you.
We,
very much.
At the Ministry of Finance of Poland, we have already gone through talks with the Ministry of Health, and we've drawn a conclusion together.
Yes,
that if we introduce innovative, novel products into the market, and if we promote more novel products, and showing that only traditional tobacco products are harmful, we're maybe avoiding lung cancer, but we're maybe heading into a completely new problem when people start abusing novel products, and they might be some oral cancers, oral cavity cancers, and so on and so on. So there might be a risk that we don't see right now. We're running away from one risk, and we may be getting into another one.
So,
because now we're saying nicotine pouches or novel products are less harmful. Maybe it's too early to say that. It may be premature because the Ministry of Health indeed doesn't have the right data. So I'm keeping my fingers crossed so that you do as much research as possible to really give us evidence basis, so that we have evidence-based legal instruments and fiscal instruments that will really help us eliminate diseases rather than specific products.
Exactly so. Well, as you may hear, my clocks are saying it's 4 o'clock, so it's exactly 1 hour that we spent during this meeting. Before I'll ask every of you to say, well, 30-second comment to the end of our discussion, let me pull up 3, in my opinion, very important conclusions that we may draw. One of them is the one that we started with: less harm, less tax. The products that are less harmful shall be lower taxed, just to make them a better alternative financially, also better alternative to more harmful products. Second thing, the products that are for those who smoke should not be available for youngsters, and we should take care of that, that they'll not pose a new problem at the market. And finally, we have a very, very important, very big group of new products, and we need to focus on education and introduce this as a harm reduction in those sufferers, just to help them. But on the first stage, on the first step, we need to use education, and only education to finally reach at some point smoke-free world, which would be the goal. So now, asking you for 30-second comments, I'll start with I'll start with Dr. Korolenko. Please, Volodymyr, what would be your closing remark?
We in Ukraine follows the way of both legislation, regulation, and communication, and advocacy of healthy lifestyle. New law give us some ways to improve, to increase our level of public health, and to have new situation with uses of small tobacco, to introduce new strategies and harm reduction strategy among them.
Okay, thank you very much. Please, Emanuela, what's your final closing remark?
Well, my final closing remark is to keep taxation linked to levels of harm, to protect government revenues. You can think of, as Poland is doing, as pre-decided tax hikes, which are known to consumers, which may orient consumers away from traditional products even more, and allow the information flow to go from experts to and companies to consumers on the differential level of harm.
Okay, I would say thank you, Verona. How about Bratislava? So, Martin, what do you say as a closing remark of yours?
So, just one thing, and it is that if you look into why most of the public health policies fail, is that because they are not based on data, and that politicians or the Ministry of usually Finance wants to achieve short-term results. And unless we change this, we can't expect improvements. So I really hope that all decisions will be made based on data and with medium to long-term results in outlook, in consideration.
Thank you very much. And last but not least, Director Pylak, what would be your closing remark for this discussion?
To me, increasing taxation on harmful substances, tobacco, and substitute products is a very important step to curb consumption. So hopefully our planned hikes in taxes will lead to yet another drop in the number of people addicted to tobacco products. So this is what I hope to achieve. Thank you.
Hopefully, yes. Thank you, all the panelists, for your kind agreement and for your participation in today's panel. Thank you all, guys. Well, I hope see you again during the next panel on public health needs and on public health perspectives. Have a wonderful day, and to all those who are listening to us, thank you for being with us this afternoon. I hope you had as much time as we did. So have a good one and see you next time. Thank you.
Thank you. Bye.
Thank you.
Bye-bye.